Doctors Without Borders was founded in May of 1968 by young doctors who helped victims of major war crimes and disasters. They wanted a new brand of humanitarianism. They were officially created on December 22nd of 1971. They had 300 volunteers, including doctors, nurses, other staffing, and including the 13 original doctors. Their first mission was in 1972 to the Nicaragua capital for an earthquake that killed 10,000 to 30,000 people. In 1974, there was a relief mission to Honduras after Hurricane Fifi caused major flooding and killed thousands of people. Since 1980, there has been offices in 28 countries and over 30,000 employees around the world, and they have treated over 100 million patients, 8.2 million outpatient consultations in 2014 alone.
Since 1980, Doctors Without Borders has held offices in 28 countries, including Belgium, Greece, Finland, South Korea, and Switzerland. According to Doctors Without Borders, MSF has an international office in Geneva, an Access to Essential Medicine campaign office in Geneva, and 2 UN liaison offices, one in Geneva and one in New York City. 7 MSF branch offices operate in Argentina, Czech Republic, India, Ireland, Mexico, South Korea, and United Arab Emirates. Doctors Without Borders volunteers in over 70 countries, including Afghanistan, Cambodia, Ethiopia, France, and Guinea.
One of the 2 programs that we have decided to talk about today is the Access Campaign. The Access Campaign was started in 1999, and it is to get access to different medicines. Some of the aims for Doctors Without Borders and their Access Campaign is to push for price cuts to medicines, vaccines, diagnostic tests by stimulating the production for more affordable generic products. Also to act as a watchdog to ensure that the corporate interests don't win out of public health needs. In 2003, MSF partnered with 6 different organizations for the Drugs for Neglected Diseases Initiative. They said the aim of developing new drugs or new formulations of existing drugs for patients suffering with the most neglected communicable diseases. Another aim for Doctors Without Borders is malnutrition. As MSF states, the people at risk are children under 5, adolescents, pregnant or breastfeeding women, elderly, and the chronically ill. Malnutrition is when they cannot fully utilize food or take in enough due to diarrhea, measles, HIV, tuberculosis, and more. They need more than breast milk after the first 6 months. So, Doctors Without Borders has started ready-to-use therapeutic food. The Doctors Without Borders website states that ready-to-use therapeutic food includes all the nutrients a child needs during its development and helps reverse deficiencies and gain weight. Ready-to-use therapeutic food doesn't require water for preparation, which eliminates the risk of contamination with waterborne diseases. Malnutrition is a big problem. In 2018, over 200,000 malnourished children went into this feeding program.
How the money is used: 85% of the money goes to programs, 1% goes to management and general, and then 14% goes to fundraising.
Doctors Without Borders last noted their budget plans to raise at minimum $150 million to put toward covering the cost of the 2020 and 2021 COVID-19 programs.
Who is Doctors Without Borders, you ask? Doctors Without Borders are an independent global movement providing medical aid where it's needed the most. They do this by providing life-saving medical humanitarian care and speak out about what needs to be done. They follow 6 main principles, which are medical ethics, independent, impartial, and neutral care, bearing witness, upholding diversity, equity, and inclusion, behavioral commitments, and accountability.
What is the relationship between Doctors Without Borders and the United States? Partnership was established in 1990 in order to expand their international fundraising, recruitment, and advocacy. The United States has expanded their role by managing programs in Colombia, Haiti, Liberia, Somalia, and South Sudan, to name a few. Prior to the pandemic, the United States rarely required the services, hence why their partnership was started. Currently, Doctors Without Borders has pleaded for the European Union, the United States, and other wealthy nations to reconsider the stance on South Africa and India's patent waiver proposal. South Africa and India's patent waiver proposal would lend a hand to developing countries by allowing the manufacturing of generic COVID-19 vaccines. Doctors Without Borders believes that without sharing, the world has no chance of creating global immunity. However, the EU and US remain set to allow vaccine production to remain in the hands of pharmaceutical companies opting for profit. Doctors Without Borders currently has 165 projects in 52 countries related to COVID. Currently, they are demanding global access to the COVID vaccines, treatments, and tests. The U.S. has been called on to supply vaccines due to their surplus they have. Currently, they are offering treatments, health education, mental health support, training, and control measures. Trained healthcare workers on infection prevention and control measures.
Doctors Without Borders first launched their project in Hong Kong to focus on health education for the vulnerable groups in January of 2020. Then in South Asia, they started preparing for potential outbreaks in February of 2020. Of March 8th, 2020, the European operations started, which they focused on treating patients, improving infection prevention, and control measures. On March 11th, the pandemic is declared, and their theme was detect, test, treat, isolate, trace, and mobilize people. Of March 15th, that is when the medical supply shortages started happening. A few days later, the U.S. cases started to soar. The next month of April 11th, the U.S. is responding to emergencies, and they begin working in the communities that are hit the hardest, especially New York. And the next month of May 6th, Mexico starts becoming a growing crisis. On June 9th, international presidents call for equitable access to COVID-19 treatments and vaccines. On August 31st, Doctors Without Borders report on their COVID response so far. Since the beginning of the pandemic, they have distributed 2.27 million items of PPE. On October 2nd, India and South Africa asked the World Trade Organization to consider their waive request. October 23rd, 2020, Doctors Without Borders stopped their efforts in the United States. On December 8th, 2020, is when vaccines for all happened. On March 9th, 2021, that is when the Doctors Without Borders called for stop stonewalling, which is where the international president asked the wealthy countries to stop blocking the proposal from the World Trade Organization.
We rate the Doctors Without Borders with a B for their effort toward fighting COVID-19, with the United States having the highest amount of COVID-19 cases, with 46.9 million cases, according to World Meters. We believe that Doctors Without Borders should not have pulled out help in the United States. The help that they were providing decreased overcrowding in hospitals to help provide better care toward their patients. They pulled out support when the numbers were improving, but they have now increased again. While the U.S. is an upper-income country, they still need help. If Doctors Without Borders is going to pull out support, then they need to direct their efforts toward trying to get the new patent waived first to allow other countries to produce vaccines, but by a different manufacturer. They are giving an above-average effort into pandemic efforts, but they could do more if they had more resources to reach more countries. With more fundraising and more resources, the Doctors Without Borders can sustain aid in the United States while supporting other countries in need.